Hello, everybody. My name is Jared Young, and I'm a fourth year medical student at the University of Louisville. Today, I'll be talking about diabetes. I could talk for many hours about a lot of things about diabetes, but my goal today is to just go over some of the basic information about what diabetes is and some of the complications that can occur because of diabetes. A good reference for people who have more questions about diabetes is to go to the American Diabetes Association website, and that's found at www.diabetes.org. At the end of this talk, I'll also talk about, or I'll give some information about some of our family medicine doctors and our internal medicine doctors who are really good at treating diabetes. If you don't have a primary care physician, these are really good doctors to go see. So I'll start out by describing the difference between type 1 and type 2 diabetes. Diabetes is all about high blood sugar and insulin. Insulin controls your body's blood sugar, and insulin is made in your pancreas, which is an organ that's located near your stomach. In type 1 diabetes, your pancreas cannot produce insulin. So people with type 1 diabetes have high blood sugar because they don't have insulin and therefore need to give themselves insulin shots to control their blood sugar. People with type 2 diabetes, their pancreas can produce insulin, but their body has a hard time using that insulin. So people with type 2 diabetes can sometimes take oral medications or just pills that will help control their blood sugar. But if their blood sugar is bad enough, then they also may have to give themselves insulin shots. Okay. So on the American Diabetes Association website, they talk about the ABCs of diabetes. And I like to start with that. The A stands for A1C. Another name for that is the hemoglobin A1C. The A1C is a lab test that we draw your blood and we look at your A1C, and that tells us an average of what your blood sugar has been like over the past 3 months. If we draw an A1C and the A1C on the person is below 5.7, that's considered normal, and that person does not have diabetes. If the A1C is between 5.7 and 6.4, the person is considered to have pre-diabetes and should really think about watching their sugar intake and exercising and maybe losing some weight to help control their blood sugar so that they don't develop diabetes. If a person's A1C is above 6.5, that person does have diabetes and needs to be put on medicine to help with their diabetes. When somebody is diagnosed with diabetes, then we like to talk about what a good goal for your A1C should be. Many patients come in with A1Cs of 8, 9, 10 and above, but a good goal for anybody with diabetes is to have an A1C less than 7. But this goal might differ based on the age of the patient. So if you have diabetes, talk to your doctor about what a good goal for your A1C is. The B in ABC stands for blood pressure. We know that people with diabetes have a very high risk of having heart attacks and strokes as they grow older. So we really like to aggressively treat people's blood pressure, especially when they have diabetes. A good goal for blood pressure should be numbers less than 140/90. But again, based on the age, we can be a little bit more aggressive, especially in younger people, and maybe target a blood pressure goal of less than 130/80. Again, talk to your doctor to see what a good blood pressure goal for you might be, and see if you need to start taking any blood pressure medicines to help decrease your risk of heart attack and strokes. The C in ABCs is cholesterol. In people with diabetes, we like to check their cholesterol at least once a year. And you can talk to your doctor about the different types of cholesterol. A lot of people refer to them as good and bad cholesterol. And people with diabetes, we usually go ahead and start them on cholesterol medicine, even though their cholesterol might be fine. And that's to reduce the risk of heart attacks and strokes as well, because we know that people with high cholesterol or people who have diabetes are at increased risk of having heart attacks and strokes. So those are the ABCs of diabetes: A1C, blood pressure, and cholesterol. A couple of other things that is important to think about when you have diabetes is to think about your eyes, your feet, and your kidneys. Anybody who has diabetes, we like for them to go see an eye doctor or an ophthalmologist, which is an eye doctor who has an MD degree. And we like for them to look in the back of your eyes, because we know that people with diabetes can have an increased risk of glaucoma or high pressure in your eyes, and we want to correct that as early as we can, because that can lead to blindness. So it's very important to get your eyes checked at least once a year by an eye doctor or an ophthalmologist. We also like for people who have diabetes to check their feet regularly, because we know that people with diabetes will tend to have not as good sensation in their feet, and we call that neuropathy. So people with tight fitting shoes may have not as much blood flow to their feet, and they won't even know it because they can't feel it. So check your feet regularly to check for sores and any ulcers, and don't wear tight shoes. It's better to wear shoes that are a little bit looser fitting, that give your feet kind of room to wiggle around in your shoes. And sandals may not be the best thing for your feet either. So again, check your feet regularly. Go see your primary doctor, have them check your feet, and wear good fitting shoes, not too tight and not sandals. We also think about your kidneys, and your doctor will check your urine regularly to look for something called microalbumin and creatinine in your urine. We know that people with diabetes have an increased risk of having kidney disease, which can, if it gets bad enough, people can be put on dialysis because of it. So we really like to stay on top of how your kidneys are doing. So again, we like to check your eyes, your feet, and your kidneys. People with diabetes are also at an increased risk of developing infections. So we always recommend that our patients with diabetes get a flu shot every year, because we know that the flu shot is the best way to prevent flu. Although it's not perfect, it is the best way that we have so far to help prevent flu. And we also recommend that everybody with diabetes get a pneumococcal vaccine, which is also called PPSV 23. Even patients who are below the age of 65, we recommend that they get the pneumococcal vaccine. So talk to your doctor about getting that, because that can help prevent certain types of pneumonia, which is a lung disease and can be really, really hard, especially with people who have diabetes. So if you've been diagnosed with diabetes, the best thing that you can do for yourself and your blood sugar, besides taking your medicines, is to watch your diet and to exercise regularly. By watching your diet, we talk about watching your sugar intake, and we have a great lecture about nutrition during our compassion clinic. But cutting out some of the sugary processed foods, anything that really comes in a box like pastas, crackers, chips, things like that. Cutting out sugary drinks like sodas, juices, Gatorades, putting 3 packs of sugar in your coffee. Cutting those out can really help your sugar intake as well. Exercising regularly, at least 30 minutes, 5 times a week of moderate exercise, can really help your A1C and your blood sugar as well. We know that many patients with diabetes are a little bit overweight, and so we always recommend that people with diabetes lose some weight, so that can also help your A1C and your blood sugar as well. And finally, we also recommend that anybody with diabetes stop smoking or don't start smoking, because we know that smoking also increases your risk of heart attack and stroke. So people with diabetes, who are smoking really increase their risk of heart attacks and strokes. So finally, I told you that I was going to give you some details about our family medicine docs and our internal medicine docs. Our family medicine docs are located at Cardinal Station, and their address is 215 Central Avenue in Louisville. Their phone number for the office is 502-588-8700. Again, that's 502-588-8700. Our internal medicine doctors are located on 401 East Chestnut Street in the HCOC building, and their phone number is 502-588-4500. That's 502-588-4500. Your primary care doctors, like a family medicine doctor or an internal medicine doctor, is a great place to start if you have diabetes or are concerned that you may have diabetes. Your primary care docs will help you answer any questions that you have diabetes and get you on some right medicines to help with your blood sugar control. Thanks for listening to this talk, and I hope that you've learned a little bit more about diabetes or come up with some questions that you may have that you can either ask us during our live session or talk to your primary care doctor about. Thank you.
This isn't a flash drive. This is an e-cigarette or a vape. It's small, I can hide it in my hand, and it comes in flavors kids love. But it's full of nicotine, and that's bad. My friends told me it's safe, but I don't think so, because it has just as much nicotine as a pack of cigarettes does. I could get addicted to this. I'm only 11 years old. It can harm me, it can stunt my brain growth, and it's just bad. I thought it was just water vapor, but it's not. I just didn't know.
To understand your diabetes, you need to know about your hemoglobin A1C, which is the sugar in your blood. It is important to know your ABCs and your numbers of your hemoglobin A1C in order to prevent further diabetic complications that could occur, such as heart disease.
A is for your A1C test, a test that determines the amount of sugar in your blood over a 2 to 3 month period. It is recommended to take this test twice a year. You should aim for an A1C percentage of less than 7%.
B is your blood pressure, which you should get every visit. Aim for below 140/80 millimeters of mercury.
C is your cholesterol, which is a major factor of heart disease that is affected by diabetes. You will want to get this tested yearly, and you should be aware of the types of cholesterol in your body, which are LDL, HDL, and triglycerides. You should aim for low counts of LDLs and triglycerides. Aim for an LDL count of less than 100 milligrams per deciliter and a triglyceride count of less than 150 milligrams per deciliter. You want to have a higher count of HDL. HDL is the good cholesterol. Men want an HDL count of greater than 40 milligrams per deciliter. Women want an HDL count of greater than 50 milligrams per deciliter. Thank you, and stay safe and healthy.